And welcome back, everyone. As we told you earlier, President Obama's health care plan is back under the microscope this week. The Supreme Court is set to evaluate the massive health care overhaul in a 3-day series of arguments brought about by challenges from 26 states over the law's constitutionality.
Tennessee is not one of those states, but the impact of the president's plan on Tennesseans is still considerable. Under the law, almost 1 million uninsured Tennesseans will gain affordable insurance options by 2014.
With some aspects of the law already in effect, some have already seen benefits like lower copays, prescription drug discounts, coverage for people with pre-existing conditions, and extended coverage for young adults under the age of 26. But passing the law as is could also cost Tennessee millions. Some experts estimate TennCare could add as many as 300,000 enrollees by 2014 at a cost of more than $700 million.
The federal government will pay a full 100% of that cost until 2016 and 90% starting in 2020. But that lingering 10% could still be a hit to Tennessee.
For more on how the Supreme Court situation this week pans out and how it could impact Tennessee, we're joined by Covenant Health CEO Tony Spezia and Dr. Doug Leahy with Summit Medical Group. Gentlemen, thanks so much for being here.
Thank you.
I really want to get both of your thoughts on the Supreme Court taking up this issue this week.
Well, I think, first of all, this is a blockbuster piece of legislation. It's huge. It's transformative. It's some of the biggest legislation that's come along in a long period of time. I think for two reasons, one of which is if we look at healthcare costs, in 1950 it was 5% of GDP. It's now 17%, $2.5 trillion. Obviously, if we want to get a handle on the physical crisis in the United States, regardless which party you're in, it's hugely important that we get a handle on that. Third is the definition of what is federalism. Federalism, basically the Constitution says the federal government has so much power, the rest is ceded to the states. That will be argued at this point in time. Most importantly is what happens here in Knoxville and the Knoxville area. And I think if you look at it, clearly the uninsured people in the United States cost $116 billion. Every family pays the equivalent of $1,000 to take care of the uninsured in the United States. If we look at what would be the benefit, if you can look online and find this, 22% of people in Fountain City, Halls, and Powell, I live in Fountain City and practice, my office is in Powell, will be benefited by this legislation. So it's a very important piece of legislation. It's important for the dynamics to move forward to understand it clearly.
No doubt you echo that this is extremely important.
Absolutely. The American Hospital Association and its Healthcare for Life proposed universal coverage being an important tenet of anything. We are concerned that the fact that those who may not have legal status in the United States are ignored in this legislation. So those are millions of people who really still access physicians and hospitals, and they're not covered in the legislation. I think the other thing that is really important is to understand that we have to look at this in the context of the overall federal budget deficit, and the fact that those issues and cost may trump what we're trying to do, because we can't cover all these people without finding ways to raise money, raise taxes, or charge more to Medicare recipients, or to, in fact, reduce costs. And I think Summit and we are both, and all healthcare providers are working on ways to improve clinical quality and create processes that reduce cost. I think that's going to happen regardless of what happens with this legislation. That bus has already left the station, and we are going to be moving ahead to try to improve quality and reduce cost, working together with all the healthcare part of the system.
There's been a lot of concern over this. What are the parts of the reform that are drawing the most criticism from people?
I think there's four basic questions that the court's asked to look at, and you can see the first one happened today. The Anti-Injunction Act. First, what that says, it's an 18th century law. Should they hear about the case anyway? Because the actual tax or the assessment doesn't occur for 2 years, so should they really hear it? So they're listed those arguments today. Interesting, the government and the challengers, neither one of them brought that up. The Supreme Court asked for a separate counsel to handle that. Number two will be the individual mandate, which will be discussed tomorrow. Can the individual mandate, is it constitutional, and have they exceeded the powers? The government argues the Commerce Clause gives them that capabilities. The challenger says, if you can make us buy insurance, why can't you make us buy anything else? The third question that will be asked by the court will be heard the following day. That has to do, if you pull out the individual mandate, does the whole Accountable Care Act collapse? And the government would argue no, parts of it would, which we could discuss, and others would argue yes, it will collapse. And then finally, the fourth day will be heard about Medicaid expansion. None of this comes out of the U.S. Court of Appeals, the 11th Court of Appeals, which is the Florida decision. None of the appeals courts have argued that the medication is illegal, but the Supreme Court feels that they need to look at that in the interest of the public. So those are the four major questions that will be posed going forward this week.
As we mentioned earlier, Tennessee has already seen some benefits, in some cases lower copays as mentioned. Would these go away if the President's plan is overturned?
First of all, I think the conventional wisdom right now is that this legislation is so broad, as Dr. Leahy indicated, that the Supreme Court will have to find some really compelling reasons to overturn the entire law. The fact is that there are certain things also that have been put in place, like pre-existing conditions, like coverage for dependents up to age 26. I think those are reforms that are going to stay in place. I don't think either side of the aisle was against those things as this was being debated. So we will be able to keep, regardless of the decision, I think there will be legislation that keeps the parts that everybody agrees are good and have been good reforms for us. And I think the insurance companies would probably agree that now that they've made that step, that they're not going to go back in terms of dealing with their members.
I think one of the problems, though, is the individual mandate. If you don't have the people who don't have insurance being part of the pool to cover that, then the whole issue becomes of premium levels and pre-existing illness. That's the real challenge that's out there, and that's why basically that was developed really back in the 1990s by Senator Duganberger and the Republicans to promote the individual mandate, which led to Governor Romney passing that legislation when he was governor of Massachusetts.
And unfortunately, we're going to have to end the discussion there. Obviously, this is something that we could go on and on and on, and certainly will go on.
Thank you for inviting us.
Thank you both for being here. We appreciate your insight.
Great.
Thank you very much. And we will